Well, today is an alert day here on WPBF 25 News, and we are talking all about breast cancer. October is Breast Cancer Awareness Month, and all day long we're highlighting the latest technologies and treatments. Joining us today, Dr. Thomas Klein, a radiology oncologist at Good Samaritan Medical Center. You've been with us before. I really appreciate you joining us for October. You said it's a busy month because everyone really talking about why so many people are wearing pink. Let's start with the guidelines. They have they've changed over the last couple of years, kind of confusing to people. What do you want people to know when it comes to the guidelines in breast cancer and early detection?
Well, thank you for having me back. The guidelines for mammograms have changed quite a bit, as you just said. And there's a lot of controversy right now as to who should be getting mammograms and when. The simplest advice I would say to women is that starting at the age of 40, you should be talking to your doctor about annual screening mammograms. For some women, that may be too early. For other women, that may be just right. So you talk to your doctor starting at the age of 40, and if you've gone 10, 20 years with normal mammograms, you can start talking about cutting back on how often they are. But I think once a year is a good baseline for most women.
And when it comes to raising money, we talk about October being so busy and, you know, millions upon millions of dollars raised each and every year for breast cancer research. So I guess it begs the question, where do we stand? I mean, are we making progress in fighting this horrific disease?
We are definitely making progress. For a while, the mortality rate from breast cancer was sort of stagnant, but over the last few years, it really has started to come down. We attribute that to improved early detection, increasing awareness of certain risk factors for breast cancer, including the use of hormone replacement therapy. We're also finding that some of our newer treatments and chemotherapies are really having a big impact on how women do with this disease.
And that was going to be my next question. What is new when it comes to fighting breast cancer? I suppose every single year there's something new.
There are definitely advancements all the time. A lot of what we're focusing on now for women with early stage breast cancer is figuring out how to get the same sort of great results, but with less and less invasive treatments. A good example of that is something called intraoperative radiation. So for most women, it used to be that after surgery, you'd have to have 6.5 weeks of daily radiation. Nowadays, for many women, we're able to offer that same course of treatment in a single dose delivered in the OR while you're under anesthesia, still getting your surgery.
That's fantastic. All right, so what's maybe the biggest mistake that women make when it comes to early detection?
I think that there are, so in terms of early detection, I think women think that they're supposed to feel something wrong with them, that if there's something inside my body, I'm going to notice that there's something wrong.
Or you're going to feel sick.
Right, and the fact of the matter is that early stage breast cancer has no symptoms. And that's why we recommend mammograms for these women, to help identify these cancers before they become symptomatic.
And I know it's a small percentage, but I do want to kind of shout out to the men out there, because men also need to be aware of breast cancer. Do you see a lot of male patients?
So male breast cancer, it's about 1% of breast cancer, so it's pretty rare to see it, but men do get breast cancer. Treatments are the same for men, and they do reasonably well with our treatments. So we definitely see men, and as long as they go for treatment, they have very good outcomes.
All right, good advice. Hopefully we're able to share a lot of really good information, and people out there getting their mammograms and their annual checkups. Doctor, thanks so much for joining us.
Thank you for having me.
We appreciate it. We'll be right back.